Officials in Los Angeles confirmed 2 new cases of coronavirus Friday. That brings the state total up to 13 patients. One of them worked in the quarantine station at the Los Angeles International Airport. A different screener there was diagnosed earlier this week. Kris Van Cleave reports from LAX.
With the spread of the virus, people are wondering if it's safe to fly.
Doctor, would you get on a flight today?
I would get on a flight if I needed to.
Doctors we spoke to said yes if you're under 55 and have no underlying health conditions.
If you're a 25-year-old and get on a plane, you're going to be fine. Even if you get the virus, you're going to be fine. But if you're 75 or are getting chemotherapy or have a heart condition, it probably makes sense that you stay home now.
With a sick person next to you on a plane, CBS News contributor Dr. David Agus had this advice.
If that happens, ring the bell, tell the flight attendant, and tell the person next to you, would you mind putting on a mask? And in today's world, where we are one community, they should not mind.
The plane itself is not considered unsafe because the air is filtered for viruses and bacteria every few minutes, and airlines have put new cleaning procedures in place. It's getting to the plane where you're more exposed.
It's standing in the cattle car at the gate where you're all waiting to get on or getting off, where many people are congregated right together. It's every bit as much a risk as being on the plane itself.
Here at LAX, a second medical screener has tested positive for the coronavirus. Americans returning from 4 countries with the greatest outbreaks are subject to health screenings in LA and 10 other airports. But a new study finds 2/3 of infected travelers are likely making it into the U.S. undetected.
And Kris Van Cleave joins me now from LAX. Hi, Kris. Tell us what types of safety precautions you're seeing at the airport there. Are many people walking around with face masks?
Absolutely. We are seeing a lot of people wearing masks here, more so than at other airports I have been through this week, and I've been through several. LAX, as we're speaking here, is rushing to add hand sanitizer stations. They have 250 of them they're adding. They have 300 more coming. They have increased their cleaning regimens. They're going through almost hourly now through high traffic areas like bathrooms and going over things like the touch screens that people use to check in, disinfecting those as regularly as they can now, as often as per every hour.
You know, Kris, so many of my friends are asking me, is it safe to go on a plane? Should I cancel my spring break plans? You know, they all think because I work in news, I have the answers to these questions. But in your package, you say that you're in no more danger on a plane than you are in any crowded area. Is that correct?
In fact, in some ways, you are probably in less danger on the plane itself because the air on board an airplane is filtered for bacteria and viruses every 2 to 4 minutes. So you actually incur more risk probably if you take the subway to the airport or you take mass transit to the airport or while you're standing in the gate area waiting to board if you're close to people. You know, the answer that I have been telling people, it really sort of depends on your comfort level with traveling. We know that older Americans may be more vulnerable to the virus and that people with compromised immune systems may be more vulnerable. So if you fall into those categories, you might want to rethink traveling. If you're a healthy 25, 30, 40, 45-year-old, you probably don't need to worry as much, but you certainly still want to be aware. And if you're sitting next to somebody who has a cough, you might want to think about getting reseated.
And you also mentioned in your package that you could ask an airline attendant to get that person a mask. So there are sufficient masks on the planes for passengers who want them?
Yeah, planes are being stocked with masks. And, you know, what doctors have been telling us pretty consistently throughout here has been the average American doesn't need to wear a mask, but if you're sick, there is some value in doing that so that you're not spreading the virus. What we understand so far about the coronavirus is, you know, it is spread through droplets like a cough or a sneeze, and that has to get ingested. It has to get into your lungs in order for you to feel the effects. So if somebody is wearing a mask, that's going to knock down the coughing and anything else. And that hopefully works to mitigate the risk. And it's sort of a 6-foot radius that you want to think about keeping yourself away from others.
As long as there are enough of them, as long as the planes aren't running out. Now, Kris, you also mentioned that 2/3 of infected travelers are somehow making it into the U.S. despite current security measures. How is that happening?
Well, so this is new research from Harvard, and they're saying that they think that about 2/3 of people with coronavirus won't be detected in the health screenings that are happening at 11 U.S. airports, including this one, LAX. And that's because those screenings are really just focused on looking for signs of fever. Remember, we've seen a lot of people be asymptomatic for a while, and you can be exposed to the coronavirus and potentially contagious and not have any symptoms for 2 to 14 days. That's why they have that 2 to 14 day the 14-day quarantine that people have been asking for. So doctors we talked to weren't terribly surprised that the health screenings at airports weren't catching every potential coronavirus patient because it's not like they're the testing kits that we're starting to hear getting out there. This is really just looking at signs of fever or obvious signs somebody is ill.
Right. So bottom line, what are the risks for flying domestically? Because a lot of people have to now ask approval from their superiors at work to get on a plane to go anywhere.
Well, it sort of depends on, your underlying state of health, but everything we are hearing from doctors, from the CDC, is that the risk to flying within the U.S. is low. The risk to the average American right now is low. Certainly, if you're thinking about a trip to South Korea, to Italy, to China, to places where there are clusters of these coronavirus outbreaks, you might want to rethink that travel and follow the CDC and State Department guidelines. But what we are hearing is that flying continues to be safe. I flew in from Washington to Los Angeles last night without a second thought. I am in a category of people that aren't the most at risk. If you were asking if my mother should get on a plane right now, I might give you a different answer.
Right. Well, at least what you have said has calmed my, fears somewhat about spring break travel. If you're traveling domestically,
right,
and like you said, you're young and healthy, no reason to cancel your plans, it seems to me.
Yeah. I mean, keep in mind, it is the height of flu season, so you want to practice good hygiene regardless, because whether it's the coronavirus or the flu, you don't really want to get either of them, so washing your hands is important.
Right.
Not covering your cough like this or with a tissue and throwing it away. I wipe down the seats with a Lysol wipe these days, just because why not? It's that little 1 extra ounce of protection that you can do, the surfaces that you might touch. But know that the airlines are deep cleaning the airplanes overnight, that there is a lot of thought being put into this. That said, you can't eliminate all risk altogether.
All right. Well, Kris Van Cleave at LAX, thank you so much.
Sure thing.